Hello, medicos. So today I will tell you about the topics, the lessons you should read from Harrison, so that your practical aspects in medicine can be covered. Okay. So I have highlighted and marked it, and you should also read these topics while you are completing your practical from either Orokundu or Balur medicine practical clinical books. Okay. So the topic you should learn during this time is, first of all, you should learn about the fever, its types, when which type of fever comes. Okay. Then fever of unknown origin. This is a very good topic for the practical examiners. And for neuro gait disorders, it is usually important when the case is regarding the cerebellar disorder. So then it is asked, as a cerebrovascular patient, they usually lie down and you examine on them, and the viva goes upon that. So gait is not usually tested in this patient while they are lying. Okay. So, but you have to read for your cerebellar disorder. It is not given usually in the practical examination for undergraduate students. Okay. Then aphasia, memory loss, and other cognitive disorder. This topic is for cortical cerebrovascular accidents. Okay. So usually the cerebrovascular accident, either ischemic or hemorrhagic, they come from the lesson is in the internal capsule. So aphasia, memory loss usually not seen, but in cortical lessons these are seen. So you have to learn the type of aphasias again, especially the aphasias which is motor and which is sensory. Then for cardiac and respiratory causes, you have to learn dyspnea grading, cough, dry cough, bronchoria, hemoptysis, how much amount the hemoptysis is can be called. Okay. Then hypoxia and cyanosis, differential cyanosis, acute cyanosis, okay, acute clubbing, edema, how to differentiate from edema to, because the sequence is different in case of heart failure, in case of ascitic, and in case of nephrotic. So the bipedal edema, the self happiness and the ascites. So this order you have to learn. Okay, and keep in mind. And also approach to a patient with heart murmur. This is very, very important. If you have a cardiac patient, so cardiac case, then you have to must know the heart murmur. Okay, jaundice. This is also for when the patient. This is usually important for general survey. Okay, then there is abdominal swelling and ascites. You have to learn every aspect from ascites. Examiner expect you have learned everything regarding ascites and chronic liver disease. Okay, anemia. Let will read this and alignments of lymph nodes. If there is a patient from CLL or CML, you have to know the enlargement of the lymph node, when which lymph node you have to examine, especially the axillary lymph node examination. Axillary lymph node examination is very, very important. Okay. And then as a long case, chronic myeloid leukemia and chronic lymphocytic leukemia, though rare, it is rarely given, but if patient with cervical and the axial lymphadenopathy came, then you have, or hard, very hard splenomegaly patient came, then you can be given CML or CLL. Okay. And in case of respiratory cases, pneumonia is important because the question, if your case is consolidation, then the question comes from pneumonia. Okay. Then infective endocarditis, usually the teacher when goes to rheumatic heart disease, then a general survey, then they ask regarding the nodules, okay, general lessons, these kind of things. Suppose they ask what kind of lesion you find in your hands, then they go for infective endocarditis. Okay. Then there is atrial fibrillation. It is also important for ECG aspects. Okay. Then you have to, your cardiovascular case goes around heart failure and the stenosis or regurgitation of aortic or mitral valve or mixed. So you have to know this, but very, very important. Heart failure with pathophysiology, diagnosis, management, aortic stenosis, aortic regurgitation, mitral stenosis, mitral regurgitation. They are very, very important. Okay. Then for respiratory case, again bronchiectasis is important, and disorder of the pleura. This part is very important because your pleural effusion case is from this disorder of the pleura. You can learn maximum thing from Harrison from this verse. Okay. So disorder of the pleural, this chapter is important. Then you have your chronic hepatitis, alcoholic associated liver disease, non-alcoholic fatty liver disease, cirrhosis, and its complication. This part is also very very important because in GI cases, your teacher expects you have read and came everything in your mind. So try to answer everything here. And acute rheumatic fever is important because in case of mitral stenosis, mitral valve pathology, the maximum Kundit is written thus the maximum case of mitral pathology is rheumatic, and rheumatic. So acute rheumatic fever, you should learn this. Okay. Acute rheumatic fever is also important. In case of cerebrovascular cases, ischemic stroke and intracranial hemorrhage, these two parts is very very important. Stroke localization, facial nerve involvement, complete or incomplete stroke, UMN or element lesions, these types are asked. Okay. And if there is cranial nerve 3 involvement, cranial nerve 2 involvement, they are also asked. And finally, the disease of the spinal cord. Read also this, but here the level and the transverse section, which type of nerve, sorry, in case of spinal cord, you have to learn the level of the spinal cord and its lesson because it is important for paraparesis. And also in transverse section, in which level which tract passes, this is important. So also read this part. So this is the basic things you must read from Harrison to complete your knowledge and also become answerable to your teachers. Thank you. Subscribe my channel, the MBBS material. Happy learning.